They are unreal. We got to see them in person when we were out there that one day.
Right,
so.
and if you like the elephants, guess what? And spending more time outdoors, it's important to remember your sunscreen. How about that?
Yes. Did you know certain medications can make your skin more sensitive to sun? What's there with the drug? Smart steps to help.
There are many risks associated with increased sun exposure. The most common and can be deadly would be the increased risk of skin cancer. Also, there's a risk of increased sunburn, premature aging, and medication-induced photosensitivity.
Photosensitivity or sun sensitivity is inflammation of the skin induced by the combination of sunlight and certain medications. This causes redness of the skin and looks similar to sunburn. There are over 200 active ingredients, so we're talking about hundreds of medications that cause photosensitive reactions to the sun, making folks more prone to sunburn, therefore at an increased risk for skin cancer.
Individuals that are at higher risk for skin cancer include individuals that are fair skinned, individuals that are skin type 1, which means they are very pale, they burn easy, they never tan, individuals that have more freckles than others, individuals that have many moles or nevi, and individuals with a personal or family history of skin cancer.
Just recently, we started our annual SunSense program. It's a program unique to Discount Drug Mart and developed to provide awareness about the potential hazard the sun poses for those patients taking medications that cause photosensitivity or sunburn. The way that the program works is that we've flagged these medications at the point of sale. So as our patients are picking up their prescriptions, our SunSense program is in place to protect them during the summer months in two ways. First, through education. Our pharmacy staff is going to provide information about the potential side effects of these medications. And second, we're going to provide them with a free sample of sunscreen. It's a nice sized tube. It's a broad spectrum sunscreen.
5 basic tips to remember when applying sunscreen are to, first of all, apply the sunscreen prior to going outside. At least 15 to 30 minutes is recommended. Apply about 1 ounce of sunscreen to the entire body. 1 ounce is equivalent to about 2 tablespoons. To reapply the sunscreen when sweating, swimming, toweling off, doing the lawn, when there's moisture on the body. Also keep in mind to pay attention to where you're at. Snow, sand, the water, the lake, those areas can reflect the sun and also increase your chance of more sun damage. Another very important thing is to check the expiration date on the sunscreen. Most customers and patients do not do that. We think of sunscreen as just an over-the-counter medication that we use and never look at the bottom. The bottom does have an expiration date, and it is true. It does expire when it says that it's going to.
Our SunSense program has been very well received. We've provided over 150,000 free samples of sunscreen to Ohioans. And much like a lot of our programs, we find ways to use in-store resources to reward our customers, but we always have an emphasis on patient care.
That's right. That is at Drug Mart. That's right, Drug Mart, where you can find all that stuff.
Not Drug Smart. And make sure you wear your sunscreen.